Hello and welcome to OncoDaily. I'm Sergey Badalyan, publishing editor at OncoDaily and an oncology fellow at Yerevan State Medical University. Today, I have the honor to talk to Professor Fatima Cardoso, president of the Advanced Breast Cancer Global Alliance and chair of the ABC8. Professor Cardoso, thank you for being here.
Thank you. Thank you very much for the opportunity.
In today's conversation, we will cover this year's ABC Global Charter and Decade Report, the 2025-2035 Priorities and Implementation, the ABC Award, and finally, how to engage with the Advanced Breast Cancer 8th International Consensus Conference. To ground everyone, let's begin with what ABC aims to settle this year. Before we dive into specifics, in one sentence, what is ABC aiming to achieve at this edition? And why is now the right moment?
So the ABC8 Conference is the main goal of the conference is the update of the guidelines on how to manage advanced or metastatic breast cancer, and this update occurs every 2 years. Simultaneously, this year will be special because we will launch the Global Decade Report and the new ABC Global Charter.
Staying with the agenda, as you said, like 2025 and 35, which 2 or 3 priority decisions or consensus areas do you most want clarity on? And what evidence will weigh most heavily?
So for this year, in terms of the guidelines, I believe that all 3 subtypes will have important updates. So there are new treatments and new evidence, both for ER-positive, HER2-negative breast cancer, but also for HER2-positive with the Fatima trial, and also for triple-negative breast cancer, including very upcoming news at the ESMO 2025. So what we will do is try to immediately update the guidelines to include all the new evidence that has appeared since the last time we have published the ABC7 guidelines and until now. But I believe that this year we will have novelties and different guidelines for the 3 subtypes. One of the other topics that we will continue to improve is the definition of endocrine resistance and sensitivity, which is something that we all discuss a lot and has particular implications for clinical trials, but it's also useful in clinical practice to know when can we continue to treat ER-positive, HER2-negative breast cancer with endocrine-based therapy.
That's such an interesting approach. And talking about that and translating it into actions, as you said, there are like several new updates. If this consensus led, as you hope, as you said, like what should the treating clinician do differently on the next Monday, let's say? Like, please just give one concrete example, if anything is already discussed and published.
I won't be able to give it today because otherwise I will be showing what we are going to discuss in the consensus session. So as people already know, the conference ends with a very large consensus panel where we will be voting on the new statements, on the new guidelines. However, the ABC guidelines always have a global perspective and also include patients and advocates in the consensus panel. And so we believe that they are really the most patient-centered guidelines. And an issue that is always concerning us is the issue of inequalities and accessibility. So it doesn't help a lot if we put in the guidelines just a list of all the available treatments because they are only available in high-income countries. And so for the clinician that practices in countries where access is not for all, and it's certainly not fast, so the latest developments will not be available for use in clinical practice immediately after the conference. So we try also to help clinicians to understand among the available options, which are the preferred ones. And so hopefully we will publish the manuscript early next year, 2026, to give time also to see if something new comes out of San Antonio. But we will also help every clinician to adapt the guidelines to their available resources. And this is what truly makes these guidelines different, is that they have incorporated the patient perspective, and they are very careful regarding accessibility and prioritization of the available options.
Okay, thank you so much, especially for mentioning the limited resources for lower middle income countries. I would ask to dive a bit deeper about this topic and turning to feasibility, especially beyond high income settings. What do you think? Where are the biggest implementation gaps, especially in lower middle income countries? And what local steps in the next 90 days, let's say, can ministries or hospitals take to close them?
Well, unfortunately, there's nothing that can be done so fast as in 90 days. But allows me to speak about the ABC Global Decade Report. So that will be launched at the conference. What we have done was to look at this last decade, 2015 to 2025, according to the goals, to the 10 objectives of the charter of the ABC Global Alliance. So things that are really important for metastatic or advanced breast cancer, starting with survival, but also looking into quality of life. And what we will be presenting is that we have seen advances in this last decade. For example, one of our goals was to double the median survival of metastatic breast cancer in this decade. I believe, and we have seen in the report, that we have achieved that for HER2 positive and for ER positive, HER2 negative, but not yet for triple negative. But to achieve that doubling in survival, we need to have access to all the available therapies, because as the natural history of this disease, you need several treatments. It's not enough to give access to just one treatment. Metastatic breast cancer is incurable, and resistance to therapy inevitably occurs. So we need to have different options, to have different lines of treatment. That sometimes is hard for decision makers to understand. And sometimes the response is, we are not going to approve this treatment because there is this other one already. And without understanding that we need several lines of treatment. So I think that's one important message to give to the decision makers, is that one treatment is not sufficient for this disease. The other finding that we will present at the conference is that the issue of inequalities and different access in this last decade has increased. It has not become better. On the contrary, it's worse today than it was in 2015. And it's not just between high income and low income countries. Within each country, and in high income countries, within different regions, patients have different types of access to treatments according to what they can afford. If they have a good insurance, the United States is a very good example. So if you have a good insurance, you can have access to everything. But the majority of those that live with Medicare, they do not have access to the most important treatments. And the same for European countries. And for countries that have a national health system, like the UK and also Portugal, where I live, still the national health system doesn't have access to everything, and it takes a long time between the approval of the drug by EMA and the availability of the drug in clinical practice. So I think that one issue that we can help decision makers, and it's up to us, the oncology community, is to use priorities. So we cannot ask a government to make everything available. Most governments cannot afford to do that. But we can make a list of priorities and say, these are the most important treatments for this subgroup of breast cancer. And these are the ones that you should give priority. And the other ones, well, if there is enough money, great. But if there's not, they are of lower priority. And that's what we also try to do with the guidelines. The Global Decade Report looked also into this complex issue of accessibility. And we always focus a lot about expensive drugs or expensive medicines. But there is an additional problem. Most of the new treatments are targeted, are biomarker led. But the biomarker test is very often not reimbursed, and it's out of pocket for the patient. And if you cannot have the biomarker, you do not know if you should use the drug or not. So when the governments or the health authorities approve a new treatment, they have to approve the biomarker test that goes with the treatment. They are not separate issues. And we will also discuss a lot of other things besides medicines, like the importance of high quality pathology and a high quality diagnosis, and also availability of radiotherapy. There is still a huge inequality in access to radiation therapy, and radiation therapy is fundamental for the treatment, for example, of brain metastases. And there will be a session fully dedicated to brain metastases and the advances and how we should manage. But obviously, that needs the proper access to the different types of treatments. So there will be a lot to discuss at ABC8, a lot of novelties presented by because of this report. We will also look into what has been published in these last 2 years since ABC7, and that will serve the basis of the new guidelines and also of our goals to the future, the ABC Global Charter for the decade to come, 25 to 35. And what we should all together, the whole community, fight for.
Okay, so these insights are very interesting, and thank you for these detailed answers. You literally cover most of the questions that I've prepared for you. And talking about the implementation that you just said and the new ideas and the novelties that you're going to bring with the new agenda and the discussions during the conference, my question is about like the accountability and data. Like, how will you track whether those goals are changing care? Like, have you decided what KPIs or data sources will you rely on, and what will success look like for you by 2030?
Yes, thank you very much. I think that is very important. And when we were discussing the whole community together, patients, healthcare professionals of all the disciplines, policymakers, industry, everybody that is involved, we wanted to have goals that could be measurable, right? Sometimes some goals are easier to measure than others. So if we speak about survival, it is easier to measure, at least in clinical trials. There is also some advances on using real-world data to understand how these findings in clinical trials then translate into the real world. So, but there are other goals that are much more difficult to measure. For example, we have kept our goal to fight against stigma and misinformation. As you know, the internet is a valuable tool and we will use it a lot, but it's also an instrument for misinformation and for fake news very often that do not help the patient. So how are we going to measure if this will be better in 2035 than it is now? I hope that artificial intelligence tools to scan the internet will help us do that, but it's a more difficult measure or a more difficult objective to measure. In conjunction with the latest Lancet Oncology Commission on breast cancer, we have set up specific KPIs. For example, another goal has to do with the fact that cancer registries do not register relapse. So they register diagnosis and death. So you have the incidence of cancer and the mortality. But currently there is no country in the world that knows how many people are living with metastatic cancer. Metastatic breast, metastatic lung, metastatic colorectal, whatever cancer. And this is because of the way the registries register the data. And the problem is that the cancer registries do not follow the patient, right? Do not track down the patient. And these days, one patient can have a diagnosis in one country and maybe then move country or move city and goes to another place, and you lose track of the patient. So there's a lot of work that the ABC Global Alliance has been doing with a lot of partners, including IARC, to try to define what data should be collected and how could we track the patient. For that, we need some waivers on the data protection laws. Otherwise, we will not be able to cross-reference databases. So we have also put some KPIs there. We would like that at least 50% of the cancer registries will be collecting relapse data by 2035. It's a very ambitious goal, considering that none is doing it now. But we have to be ambitious if we really want to change the way that things are and improve the lives of patients. If you do not know how many patients live with this disease, how can you properly allocate the resources, right? So this is a very, and we provide some solutions for this very complex problem.
Thank you so much. And as you said, of course, like you have to be ambitious to change something. And I believe that you're ambitious and the objectives will be satisfied by the deadline you hope for yourself for 2035. And these implementation and changes look so promising. And one last question about this part of our conversation I would love to ask. You mentioned several times in comparison with the last decade's report, 2015-2025, and the upcoming one. So I would love to finally talk about learning from the experiences. Of course, you have already covered most of the things maybe you would say during this part, but what's meaningfully different about this cycle specifically, this upcoming cycle? It can be scientifically or policy focused. And what will you do differently based on lessons you have already learned?
You know what I believe that would really make a difference in this next decade is I of course have one wish, but I know it's only a wish, and that would be that the inequalities would start decreasing, that we could close the gap in inequalities. But I'm very realistic, and I know that this is a very complex issue, and that the world and the society we live in is increasing the divide and not really closing. But we have to all together fight against that and to at least minimize the gap that exists. But the other thing I truly believe we need to do specifically for advanced breast cancer is a change in mentality. For all these years, we have always said, and this is the correct message, that this is still an incurable disease and treatable but incurable. However, with the advances in science, we believe that at least for two of the subtypes, the ER positive, HER2 negative, and the HER2 positive, we could aim to transform this into a more chronic disease. And when we say chronic disease, it's a disease where patients can live for a few decades, not a few years, right? Like diabetes, hypertension, these are chronic diseases that you can live for several decades with continuous treatment, but a good quality of life. And I think that's the mentality switch that we need, is for all of us, researchers, physicians, all types of healthcare professionals, and also the advocates. And for that, we have to understand that will be also a burden for the health systems. And so we need to help the health systems to take care of these patients that will live much longer, for them to be able to be treated appropriately and to have a good quality of life. So I think there is this mentality change that needs to occur also within the community of advanced breast cancer, as well as other advanced cancers. So I hope that in 10 years' time, we will be looking at this disease from a different angle and a different perspective.
Thank you so much. From my side, I totally agree with you, especially changing the mentality within the community will help a lot in favor of changing how you approach the disease and how to make it more chronicle, as I said. To sum up, to close this part of our conversation, I would love us to move on to the ABC Annual Award. Like, by recognizing impact, awards can catalyze adoption and scale. So with it in mind, I know that the 2025 ABC Award will be assigned to Larry Norton in recognition of his instrumental and long-standing contributions to the breast cancer community. What change do you hope for the winner catalyzes over the next 12 months?
Well, I think that Professor Larry Norton will be the best one to answer to this question. But the decision to award the ABC8 award to Larry Norton was an unanimous decision by the committee, because Professor Larry Norton has had a tremendous impact on breast cancer, both in terms of research, in terms also of clinical implementation, but also in terms of advocacy and funding for academic research. So research that really addresses needs of the patient. So he has been instrumental through the Breast Cancer Research Foundation to provide this academic research. And one thing that is, as always, advocate for also is collaboration, multinational collaboration, to tackle issues that are difficult to solve just within one country. So there are several working groups within the Breast Cancer Research Foundation group to tackle different issues. For example, breast cancer in male patients or brain metastases, which are rarer conditions and need a multinational collaboration. And since the very start of the ABC effort, from the conference and the guidelines and then the development of the Global Alliance, Professor Larry Norton has been with us through the beginning in a highly supportive manner. So I think his findings are imprinted today in our breast cancer care, and he has also served as an inspiration for a number of generations of oncologists around the world. So it's our great honor and pleasure to give him this award.
So thank you so much for a detailed explanation, Dr. Cardoso. And for the last part of our conversation, I would like us to discuss the upcoming conferences, logistics, and participation, which will be held in Lisbon, Portugal on November 6 and 8. And for everyone interested in participating, let's close with how to engage this year. So whether you're attending on site or joining virtually, here is how to make the most of ABC8. So Dr. Cardoso, for on-site or virtual attendees, what's the best way to engage with the program, and which one session is truly can't miss for clinicians who treat metastatic breast cancer weekly?
So starting with the last part of your question, the one session that the attendees cannot miss is the Saturday morning session, which is the Consensus Guidelines session, where we will discuss and vote on each of the guidelines that will then be published as a manuscript. That's always the highlight of the conference. Obviously, I would also call the attention to the opening ceremony, where we would launch the Global Decade Report. We will have our keynote speaker with which is always someone with a lived experience of metastatic breast cancer, and we will also give the award and listen to the lecture of Professor Larry Norton. So these are the two sessions. I would also advise everyone to visit the online platform, even for those who attend live, that to go to the virtual platform, because there are a lot of new and exciting information and tools that will be put there on what we call our virtual conference bag. So go and have a look, because there will be some interesting pieces and tools for you. And for those who attend live, and for those who have attended previously, they can tell you that it is a conference that has a very special environment, because there are people from all over the world and from different disciplines, healthcare professionals and patients and advocates. And the networking is fantastic. And please share your feelings and your thoughts through our social media, independent if you are virtually or if you are in Lisbon. And if you haven't registered yet, please do, and at least attend virtually because it is a very special conference.
Unfortunately, I will not be there in person, but I will definitely follow the conference virtually, and I will be there. I will be in the virtual conference deck, as I said. And yeah. And for people living with advanced breast cancer, and for also advocates, what near-term practical takeaway from this year's conference could improve day-to-day life?
So for patients, of course, what we try also to pass the message to patients is that being treated according to the guidelines and by a multidisciplinary specialized team is fundamental for survival and quality of life. So this is the most important message for patients. So make sure that you choose your treating team as being a multidisciplinary specialized in breast cancer, and that they provide you evidence-based treatments, that they provide treatments based on guidelines. For the advocates, since they are so deeply involved in ABC, and we all the sessions were co-developed with them, I think that they will be very happy and will be able to take home a wealth of new knowledge and a change of experiences that they can then try to implement in their own countries. We will also have immediately after the conference the meeting of the ABC Global Alliance with all the members, and we invite everyone who is in Lisbon to attend, because we will be discussing what should we do in these next 10 years, what should be the priorities of the Global Alliance to continue to improve the lives of these patients.
Thank you so much, Professor Cardoso. I really appreciate your time taking to have our conversation.
Thank you.
For your clarity and insights and your detailed answers. We will definitely add registration details and key resources below. So I encourage everyone to join us, send questions, and be part of the conversation shaping ABC care. I'm Sergey Badalyan with OncoDaily. See you at ABC8.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.